that Just Recovery Simcoe did when we were kind of working together on this letter was to really focus on the social determinants of health. And we felt if you made budgetary decisions based on equity and the social determinants of health, that's a really good foundation. So I'm assuming that both of you would agree with that focusing on recovery, focusing on dealing with climate starts with those two basic principles. What kind of initiatives would you hope to see? What are some initiatives that you would hope to see that would come out of an equity and a well-being first perspective? Start with you, Randy.
Well, I just want to comment on money a little bit, which is, it's very important to remember that money is not wealth. It is a symbolic representation of wealth. And if your problem involves not having enough imagination to figure out how to move money around, then you're going to be in a lot of trouble. The fact is, when we're solving these problems, we have to think of what is the problem we're wanting to solve, and do we have the resources, not the money, but the resources to solve it. Usually resources mean people, and because all wealth flows from labor ultimately. And I think it's just really important to say, okay, if we have the problem and we have the people, we can solve this problem regardless of what's going on on the money side of it. If we put people to work doing useful things, whether it's childcare or building a bridge, whatever it is, everything is going to lift up with it. Now, having said all that, I forgot your question.
It was just what kind of initiatives, if we went with well-being and an equity first kind of lens to put decisions through how we spend money, where we allocate it, what kind of initiatives do you think would be a part of that you would like to see that we haven't fully embraced right now?
Well, I think everybody has their favorites. It was interesting, Dr. Howard talking about $12 billion would give us a fantastic childcare system, or at least an acceptable one. We know also that $15 billion a year would give us national pharmacare. And compared to what's happened with COVID, we can see that these are actually small numbers. They're not big numbers at all. So it's on the scale of Canada, these things are doable. One of the things we haven't talked about too much is the transformation of the economy from fossil fuels to, I presume, some sort of super electrified world. That is going to take some investments. It's going to take some reallocation of wealth. But what I'm kind of hoping is that more and more fossil fuel industry companies start to see themselves as energy companies, and they start to say, you know what, this is a dead end, taking hydrocarbons out of the ground and pouring them into the air. So, you know, it's not one thing or the other. Supporting incomes is super important, because if people who have low incomes have enough money to get by, they will lift up the economy as well. So, like I say, everybody has their top 10, but I would definitely put anything to do with care. I mean, I think pharmacare is a no-brainer, so affordable and so doable. And then electrification of the economy and how that would work, I think, is really something to look at. And conservation, obviously.
Yeah, for sure. And before Dr. Howard goes and to answer the question, just a reminder, we're going to now open up after Dr. Howard goes to questions from the audience. So if you're on Facebook or Twitter, please feel free to add in the comments, or if you're on our Zoom chat here, then feel free and to put your question, and Adam will be going through after you, Dr. Howard. What kind of initiatives would you like to see a part of it?
Yeah, I share many of Randy's priorities. Certainly, I think a guaranteed basic income would help us a lot. I know there's all sorts of different measures that are being proposed now. And I also know that I see a lot of people at 2 in the morning in the emergency department when they haven't managed to fill out the right form. And that, you know, we've already got housing crises in multiple jurisdictions in Canada. And, you know, if we don't support that initial income to keep people housed right now, like the minute they lose their house or their housing situation, everything else just spirals. And we know that the cost of the system just goes way up. And so I think that that's really, really a priority. And after that, I agree. I think that I'm increasingly liking the idea. It was actually proposed by Dan Raza, who's, I think he's still the chair of Canadian Doctors for Medicare, of a Canadian Community Care Act. So to parallel the Canada Health Act with the same 5 principles associated with it. And the priorities for me within that, I would actually put childcare in there. I think we need to acknowledge how important it is and put it in there. I would also put pharmacare in there. I think psychological care is going to be really, really important over the next few years. I'm seeing tremendous levels of anxiety. And when you think about it, you know, if one person usually like loses their job under normal circumstances, they can ask for help from a bunch of people who are living relatively stable lives. And now we're all, for another analogy for you, Randy, this in my head looks like, have you ever stood up on a air mattress in a lake? Yeah. And tried to hold on to somebody else who was standing up in an air mattress in a lake? Like, it's just instability all around, right? And so like the number of people presenting for mental health related complaints that I've seen in the Emerge since the pandemic started has just skyrocketed. And we know that quarantine, like there was a review in the Lancet that showed that there's mental health impacts associated with quarantine. And that was pre-COVID. They were looking at previous episodes, but there was anxiety, depression, PTSD. We know that, you know, grief and not being able to see one another in terms of our family supports is going to also increase stress. And all of the it was Deloitte, I think, did quite an interesting study looking at the rates of claims that they had for anxiety and depression following the Fort McMurray evacuation. And they were thinking of that sort of an acute traumatic event, and they were elevated for a year or two after. So it's not like, you know, we need to really be anticipating a prolonged period. A good friend of mine works at the BC Centre for Disease Control, and apparently they're saying sort of internally, like, think of it as 2 years. It's at least 2 years. You know, by the time optimistically we get a vaccine going and we roll it out and we, you know, have people sort of vaccinated up to a level that's significant, at least 2 years, and then we're all still recovering. So I really do think that we're going to see increased mental health stress for quite some time. And most places in Canada don't cover care outside of the hospital the way that they ought to. So if we can start to fund some of that, that would be really helpful.
And if I could just
it looks like we're going to have some. Yeah, go ahead, Randy.
Well, I just wanted to add one thing, which is we need to deal with the housing affordability crisis. And that means not just homelessness, but the fact that people's incomes are being sucked into housing in a way that they never were in the past. And it's entirely the effect of poor government policy over the last quarter century. You know, I like to say, when you lose your job, you go home. What happens when you lose your home? You're going nowhere, right? And it's just so fundamental to having stable lives for people, and stable mental health is housing.
Yeah, for sure. So just before we get to Adam with the questions in the chat, before you go, Just Recovery Simcoe has a survey up. We'd like you to take 2 or 3 minutes to do it. Basically, the survey is to get your opinions about what's important in your community, how you feel about your community, what kind of things you'd like more or less of. And the plan with the survey results is to present them to municipal politicians and provincial leaders to kind of say, hey, here's how people are experiencing the community, and here's how your constituents are seeing it, as a way to help push the marker a little bit more in favor of Just Recovery. So Adam, do you have 1 or 2 questions here for our panelists?